My name's Bridget. I'm the caseworker for clinical services. We have a staff of over 160 medical personnel, including doctors, physician assistants, psychiatrists, dentists, EMTs, nurses, social workers, physical therapists, an optometrist, and a dietitian. We operate our own pharmacy, and we have complete digital X-ray technology. When a person arrives in receiving an orientation, they are given a booklet with complete information on the healthcare services provided at the prison. They're offered a physical, a dental exam, and a mental health review. If they have an immediate need for care or medication, it is provided for them that day. If they've been receiving care from an outside provider, we'll ask them to sign a release of information and we'll obtain the records from that medical provider so we can continue with the care they've been receiving. All inmates are instructed on how to receive health care by filling out a request form, but emergency concerns can be reported to any officer and they will notify clinical services immediately for assistance. We're staffed 24 hours a day, 7 days a week, 365 days of the year, and regular clinic hours are held Monday through Friday. Emergency treatment is always available any time of the day or night. Health care will always be provided regardless of the inmate's ability to pay. They will never be denied access to health care, medication, or medical supplies. Currently, there is a $5 copay to see a healthcare provider, but there is no charge to see a mental health care provider. There may be charges and rental fees for some services, equipment, and supplies, and some items such as dentures will need to be paid for in advance because of the contracts we have with our outside providers. Any charges are placed on their inmate account, and we're able to take up to 60% of any money they receive to pay off these charges. If they receive any treatment at the hospital, they're required to pay a copay of up to 10%, but this is only up to a maximum of $2,000 per fiscal year. Please keep in mind that we will never ask you to send them any money in advance to pay for any services, equipment, or supplies. We also utilize the services and clinics of the University of Utah Medical Center. Some inmates are actually transported there for treatment, and others are seen through the closed-circuit telemed clinics that are held here on property. We also hold regular chronic care clinics for issues such as diabetes or cardiac care, obstetrics, liver failure, and asthma, etc. We have our own pharmacy which provides all the medications they need, so please do not send in any medications, even over-the-counter medications. We're aware that many prescription drugs can be abused, and so they will be provided with the medication that they need, which may not be the medication they want. They're allowed to keep some of the medication with them, but others are held by us for security reasons, and they come to pill line each day to receive their dose. Medications are provided for free, but there is a $2 dispensing charge per month for each prescription. Some over-the-counter medications such as ibuprofen, Tylenol, and Pepto-Bismol are available for purchase once they are housed in general population if they'd rather not see a doctor for some minor complaints. We cannot give you information about their healthcare status, as this would be a violation of health information privacy laws. But all inmates are told how to access their medical records, and they can either read those to you over the phone or they can send you a copy through the mail. Inmates cannot be forced to receive health care against their wishes, nor can they be forced to take medication unless they're a danger to themselves or others. We can also not treat medical problems that we don't know about, so we encourage all inmates to be open and direct in telling us what their medical concerns are. Inmates are evaluated by clinical services for appropriate placement at county jails. Generally, a medical provider only goes to the jail once a week, so only inmates without chronic medical conditions or mental health issues that need close monitoring are referred to county jails. Some medications that can be highly abused are not sent to the county jails because we cannot monitor how they're given. And so inmates that have been prescribed these medications will not be cleared to go to county jails. If your family member wears contact lenses, we request that you send in their prescription glasses for them, as they will not have access to cleaning and storing solutions. and wearing their lenses for an extended period of time could cause infections. The glasses frame should be made of plastic without any decoration, and they can have a case as long as it's made of a soft fabric material. Sunglasses are not permitted for any reason. If they're receiving any government benefits such as food stamps, unemployment compensation, or Social Security benefits, please notify these agencies as they need to discontinue these benefits. If not, these agencies will require repayment of any overpayment made while they've been in prison. Clinical Services also has staff at Central Utah Correction Facility, and we operate routine clinics Monday through Friday. If there are any emergencies there, they are sent to the local hospital or to Draper for continuing care. If you have any more questions, please check the website. Thank you.